Um, our mission here is transforming cutting-edge research into action, and so that's why we have some cutting-edge researchers here and some people making actions and policymakers to do that translation. My name's Lee Crawford. I'm a senior research fellow in our education and child wellbeing program. We've called it that specifically because we think there's not enough attention to the child wellbeing side of the problem. And so it's fantastic to have Salim Gillespie here today to present on gender-based violence in schools, which exactly is a topic that we're really passionate about here. My colleagues, Gabriela Smurley and Ening and Dave are leading our work here on violence measurement and the consequences of violence and prevention, including working on a systematic review of school violence intervention. So it's really exciting that we have another paper to add to that review. The last time I looked, there was very few studies. So this is really fantastic that we're learning more about what works to prevent violence. Salim is an associate professor at Trinity College Dublin. He did his PhD here in London at the LSE. He's affiliated with JPAL and CEP and BREAD, all of the top development economics networks, very prestigious. And I would encourage you to take a look at his website, where he has a whole range of really fascinating research on education and gender and social norms. So we have people joining us online on Zoom. So if you'd like to speak, just tap the microphone in front of you, and when it turns red, it's switched on. And we'll be recording this for people to watch back later. I think that's everything. Over to you, Salim. Thank you and welcome.
Thank you so much, Lee, for that wonderful introduction and for having me here. Let me just share my slides on the screen. Okay. I hope everybody can see them now. Great. So today I will be talking to you about our project titled Gender-Based Violence in Schools and Girls' Education Evidence from Mozambique. And this is part of, this is work with a large team of great researchers that you see here. Sofia Amaral, who's at the World Bank, Aisha Garcia Ramos, who's at Passau University, Sarita Ore, who is finishing her PhD at Columbia University, my colleague Alejandra Ramos from Trinity College Dublin, and Mika Siviaci from Princeton University. So what motivated us going into this project is actually thanks to the reports that were published by CGD that I'm sure many people in this room have contributed to as well. We know, unfortunately, that there is very high prevalence of school-related violence in general, and specifically, we know that there is high prevalence of school-related gender-based violence, in particular in sub-Saharan Africa. Having said that, unfortunately, as Leo already said, there are very few studies still that try to understand the root causes and also interventions that can effectively address this issue. Just like the numbers that we have from the various reports are very concerning. For example, Mozambique, which is the context of our study, there has been a recent report that showed that 70% of students reported in the study that they believed girls in their school experienced sexual violence. And 40% of students in general reported experiencing school-related gender-based violence, and girls are typically, on average, more at risk of experiencing sexual violence, according to CGD's recent report. Now, this is obviously an important issue to tackle in itself, but it's also important when we think about the consequences for downstream outcomes that adolescent girls who typically are more at risk of experiencing sexual violence would experience. Because in this period, as we know, we all go through it, it's a difficult period, and many important investments are being made, many important decisions. And in particular, given that now that we're talking about school-related violence, we are particularly concerned about its consequences on education and human capital investments. And I've already said that unfortunately there's still growing but limited evidence base on effective strategies to curb violence against girls in schools, and also the causal link that this violence will have with their education. I mean, it sounds very intuitive and obvious that there will be a link, but you know, it's also important to quantify that link, and so that we can make the case even stronger, so that this is an important topic to address. Of course, yes.
So when you're talking about gender-based violence in schools, do you mean by school staff?
No, so in this slide, not necessarily, and we will try to differentiate this, and we will try to look at, depending on who the perpetrator is, whether it's peers or students versus staff, because obviously both the causes and the consequences and the interventions might be different depending on where it's coming from. Absolutely. So our research question is therefore, can strengthening gender-based violence support systems and creating awareness about the issue, both in terms of identification, but also about how to address it, how to report it, be an effective way to address the problem? And then what would be the ultimate effect in terms of girls' schooling? And what we do in this study is, this is not just us, of course, it's a collaboration with the Ministry of Education in Mozambique, UNICEF, and other partners. Together with the Ministry of Education, we sat down in Maputo at their offices, and they were already aware of the problem, and likewise UNICEF, and they had already started building a certain infrastructure to address this issue. And part of that, they had identified what they call gender focal points. I will refer to this as GFPs. And these are teachers whose main job is to teach a certain subject in school, but then the ministry had identified these through their network of the head teachers, etc., as so these teachers were identified to be the first point of call to provide support and guidance to students who experience any violence, and particularly gender-based violence in schools, to help them to report it and to take actions about it, and also to create awareness both amongst students, but also amongst the teachers, that, you know, this is like, what are the legal consequences, etc. But having said that, the ministry was very upfront with us, and they told us that, you know, maybe the capacity building side was not sufficient yet, and especially in remote areas, even though these teachers were identified, they may not necessarily exactly know what to do and how to do it. And secondly, we also decided to target the students and improve their awareness about gender-based violence. And again, this was something that the ministry was already trying to do, and I will show you later, they had developed a curriculum about it. But going back to the question, so if part of the challenge is that, you know, if, let's say, staff and teachers therefore are potential perpetrators, they were concerned that maybe the curriculum would not necessarily reach the students through the usual method of just education. So we together with them, we tried to come up with a way to make sure that it is delivered to the students as intended. And we decided to target 6th and 7th graders. So in Mozambique, this would be the last 2 years of upper primary school. And after the 7th grade, they transition to secondary school. And that's where you, on average, see a huge drop in school enrollment rates. And so therefore, especially when it comes to girls' enrollment, they were concerned that this issue is part of the reason. It could be part of the reason. So we decided to target this age, level. And also, if you think about in terms of age, given that on average they start school around 5 or 6 years old, so this is also a critical period. It's like adolescence, and the risk of experiencing gender-based violence is also increasing rapidly in this period. So that's why we decided to target this age group. And then, in order to understand the effectiveness of the intervention, which I will provide many more details shortly, we implemented a randomized control trial where we randomized the intervention itself and certain aspects of the intervention at the school level. So we're going to have quite a large number of schools, or more than 350 schools, and then we randomly selected some of them to be control schools where the intervention is not going to take place. And then the others are going to be, we will implement the intervention, but in different ways. So in some schools that I will refer to as T1 or treatment 1 group, we train these GFPs to make sure that they're aware of their duties and how to perform them. And then the GFPs would go back to the school and then provide the training to the students, and focusing only on the girls, on the girls students. This is in T1 school. Then in T2 schools, again, we train the GFPs, and then they go and train the boys in the schools. And in the third group, T3, the GFPs are trained, and then they go back to the school and train both girls and boys together. The reason we decided to target different girls, boys, or all of them is we are trying to understand the differential effectiveness of providing awareness to potential victims, who are more likely to be the girls, and or potential bystanders, and of course potential perpetrators if we think about peer-to-peer violence. So that's why, like, we thought this way we can understand the root cause of the problem better, so that hopefully we can inform future policies more effectively. Okay. And then another strength of our study, we think, is that we will then utilize multiple sources of data to understand the impact. So we rely on surveys with students, with the gender focal points, with the other teachers, as well as we were able to establish a partnership with the national helpline, Lina Fala Criança, who is in charge of collecting. So they are the first port of call for any type of violence that children experience. They're supposed to call this helpline. So we got the records that they were able to share with us, which are mainly the location of the call and the day of the call and the number of calls they received. So we will use that to also understand certain impacts, as well as administrative data on school registration rates. So just to quickly summarize what we find, the main finding we have is that we find the intervention is effective in reducing violence that is perpetrated by teachers. In particular, we find that girls that are in any of these treated schools, they report to us that in the follow-up survey, they were almost 70% less likely to have experienced violence from school staff. And when we try to unpack what is the mechanism, what is the main driving element of the intervention behind this, our evidence suggests that this is mainly driven by those gender focal points who receive the training. They become more proactive. They're better able to do their jobs. So they provide better institutional support to girls. And girls also become more proactive in reporting to them, and this deters teacher abuse. When we think about instead peer-to-peer violence that girls experience, unfortunately on that dimension, the intervention did not really have any significant effect. So in a way, there we failed to reduce peer-to-peer violence. Then when we look at the other downstream outcome, girls' schooling decisions, again, using the school's administrative data, we find that these reductions that in gender-based violence that girls experienced, it translated to effects on girls' school enrollment as well, but only in schools where girls themselves were trained, were part of the training. Because if you remember in the previous slide, I showed you we had some schools where only boys received the awareness training. So in those schools, even though we also find some reduction in gender-based violence, we do not, however, find that translated into improvements in girls' school enrollment. And so we puzzled over this, and we thought a lot about this, and we dug into our data. And we find that, like, we believe that the main explanation behind it is that in order for concrete actions to be taken to address the problem, we need to activate two things. We both need to have the right institutional support, so that like the GFPs, for example, in our context, can do their jobs properly and support potential victims. But we also need the victims to come forward and be more proactive in reporting any violence experience, because only then concrete actions can take place and risks, therefore, can effectively be reduced. And that translates into actual impact on schooling decisions.
I'm sure you'll come to this, but just wondering about enrollment. Do you mean girls being more likely to drop out, or is it attendance on a day-to-day basis?
Right. No, that's a great question. So we have data on enrollment. We don't have very good data on attendance, but of course that would be great to look at as well. But the administrative data we were able to obtain from the schools was enrollment rate. So when I said that this affects girls' schooling outcome, what I mean is retention rates in school, so mainly going to secondary school, improves when teacher-perpetrated violence goes down and when girls themselves receive the training. Yes.
I was wondering whether you had any data on the parents.
We don't. So yeah, again, that would have been great, but we were not able to collect data from the parents. But yeah. And final thing, we also remember I told you that we have these records from the national helpline. We find that in districts where we implemented the project relative to the neighboring districts, the calls that the national helpline received significantly increased, and that's again consistent with more reporting and more proactive reporting from the girls and or their families. Of course, the calls, like, we don't exactly know, but the victims have to be eventually involved. But it's very important, we believe, that we have both sides, like not just the students' reports to us, but also this helpline data. We think it's very important supportive evidence. Okay, now in terms of the literature, in the interest of time, I might go over it quickly, but just to say, of course, like this builds on literature and work that also people in this room have contributed to, like Gabriela's work. And we know that there is a growing evidence base thanks to this work on understanding causes of school-based violence and the implications of that on education. But we still have, I think, limited evidence on gender-based violence in particular, and especially in the context of public schools in sub-Saharan African countries. So that's where we are hoping to make some contribution. But more broadly, of course, there's again growing literature on understanding causes and addressing gender-based violence in public spaces, such as commuting to work or workplaces. And here again, our contribution is to focus on the school as a public space. And finally, our design was inspired by papers that have looked at targeting girls and or boys in the context of interventions that are related to gender norms, let's say, or gender-based violence more generally. And again, we're trying to understand how targeting girls and or boys matters for the impact and why in particular. Okay, so the specific setting of our project, together with the ministry and UNICEF, we decided to implement a project in the Sofala province. So this was partly due to the fact that Sofala was a hardest hit province in Mozambique from the recent cyclones that took place just shortly before the start of our project. And we also focused on 7 districts within Sofala that were deemed more suitable, partly due to accessibility at the time. And in those districts, we decided to try to include all of the primary schools, upper primary schools in these districts. Now, having said that, some of them were inaccessible, mainly due to these cyclones and infrastructural issues, but still our sample includes 326 of upper primary schools, so we're missing only 14, so a small share of the schools are not part of our study. And then our randomization will be at the school level, as you will see here, stratified within each district. And there are 7 districts, as you can see on the map. Right, so I've already mentioned this. The key objective of the study is to strengthen awareness and proactivity around gender-based violence at multiple levels of the school hierarchy, starting from the gender focal points, going down to the students. And I mentioned our partners, Ministry and UNICEF, but importantly, we also partnered with the local NGO, and that's how we were able to assure that the intervention and curriculum was implemented properly. So they provided very important support to the gender focal points when they went back to the school to make sure that they were able to provide the training to the students as implemented. Like, for example, they helped with making sure the projectors were working, the infrastructure was working, and any support that essentially follow-ups that the gender focal points might need were provided. So the training that the gender focal points received was a brief training, 2 days long. And during this training, we went over the gender focal points duties, and they were already selected and designated by the ministry to address this issue. However, their skill set was, let's say, was not necessarily developed enough to be able to deliver essentially the training to the students. And the training took place in the capital of each district. So all the gender focal points from the upper primary schools within that district came together as a group. And then they went over the concept of gender-based violence, especially in the schools. And then what are the procedures of reporting it and managing it? And then they went over this, the training that they will be in charge of delivering to their students in their schools. And yeah, the whole training took overall 2 days. The costs were covered, and there was very high attendance from the gender focal points. So here you see some pictures from the training. And we also created WhatsApp groups so that all of the gender focal points within the district who participate in the training, they could then stay in touch and they can exchange, any questions or any tips that they might have with one another. And then they would go back to their schools and train the relevant students, depending on the treatment status of the school. And here we, as I already mentioned, built on the curriculum that the ministry had already developed, and they had these types of textbooks that they showed us, which looked amazing, but they were worried that maybe this curriculum would not be delivered properly, and also whether like the textbook way of delivering it would be the right way. Like we were not sure either. So we decided therefore to develop some short videos and animated videos to demonstrate the issue. And in the end, the student training was actually quite light touch, only 4 sessions. Each session was taking around 1 hour, maximum 90 minutes. It would take place during school hours. And the first session would be about the concept of gender-based violence, what it is. The second would be why it's never justifiable and it's legally not okay either. And third would be about proactive behaviors that you can do if you experience or witness gender-based violence. And the final one, fourth one, was about dating violence in particular, because we thought adolescence is also a period of time potentially when dating becomes more relevant. All of these sessions were implemented by the gender focal points, and they were well attended. And in each session, it starts with an animated video. Here you see some screenshots from one of these videos. For example, you see on the upper left one, like that's an example of gender-based violence perpetrated by students, boys, towards a girl, lifting her skirt, etc. And then in the second one on the right-hand side, the teacher touching the girl another girl in class, and then asking her to stay behind. And then again, more gender-based violence perpetrated by the teacher. And then finally, in this video, the girl goes and reports it to the gender focal points, who advises her then to report it to the right helpline. And then eventually the teacher is fired at the end of the video. And all of this is like a very brief 5-6 minutes video. But our experience was these videos were very effective in engaging the students, creating a discussion. And of course, here we're not the first ones to do this type of edutainment type intervention. So we were inspired by all the literature on edutainment and showing its effectiveness. But these were followed by discussion sessions and role play sometimes. And you can see on the board, for example, they were classifying different situations and what type of violence it is and what to do if you experience or witness that. Okay, so I think I briefly mentioned to you that this is, in order to understand the impact, we decided to implement a randomized control trial. So we have those 326 schools in the 7 districts of Sofala, and then we randomly allocated about 87 of these schools to be control. So they did not receive any part of the training, neither the gender focal point training nor the student training. But they do have gender focal points, because you remember that gender focal points were selected everywhere by the ministry. So they have gender focal points, but we just did not train them. So in a way, all the effects I will show you are really the effect of not choosing a gender focal point, but it's building their capacity and then them training their students. So in treatment schools, all the treatment schools, 239 of them, the gender focal point training takes place similarly in groups. Then what differs amongst them is whether the gender focal points, when they go back to the school, do they target the girls or boys or both? And when I say both, the targeting of the boys and girls happened together in a mixed gender session, which I will come back to this later. We think it's also important to bear in mind. That was mainly due to cost considerations, to be honest, because given the sensitivity of the topic, we thought it might be worth separating them out. But yeah, due to the budget constraints, we decided to do it like this. And I'm not sure if that was the right way of doing it, to be honest. Okay, so right, I believe I already mentioned this, but our hypothesis, essentially, the reason why we designed it in this way was to try to tell apart whether targeting girls and boys might matter. In particular, we ex ante, we hypothesized that girls are more likely to be the potential victims of gender-based violence, and therefore engaging them and making them more proactive in coming forward and reporting could be important. And this, in the T1 group, for example, when only girls are trained, we are able to isolate that mechanism. Whereas in the T2 group, the reason we decided to isolate and focus on boys, because boys could be bystanders. Of course, they can witness it, and then it's important that they may know how to, what to do in that case if they witness. But they could also be potential perpetrators, especially when it comes to peer level violence. And finally, activating both can be important because both mechanisms can be at work. Moreover, it can create hopefully a collective norm change and change attitudes of the whole student body. Yes, of course.
Was there any difference in the type of edutainment videos you used for those two treatment groups? For instance, ones that target girls or emphasize girls for behaviors or actions from boys?
No, the videos and the training was identical. Yes. So, and in the videos, the example I showed you was one of them. There was another video, for instance, about dating violence. So again, boys and girls, and so yeah, it was all the same video.
And maybe just the training for the students that was delivered entirely by the teacher, the gender focal point.
By the gender focal point, but there was always the NGO, the GCR workers were also there in case the gender focal point needed any support, technically and/or when it comes to the training. Yeah. Okay, so overall, our sample is quite large. So we have 326 schools. We randomly sampled about 9,000 students from these schools, all in the 6th and 7th grades. Of course, we obtained consent from their parents as well as assent from the students themselves. The interviews were conducted in the school premises, but privately in separate rooms, individually with the students. And we followed a very strict ethical protocol and also a referral protocol for any reported cases. If anyone reported anything, they got the advice about how to follow up on that. And then about 8 months later, so the baseline took place in 2021, and shortly after the baseline, we would conduct the randomization at the province level, district level. Once the baseline is conducted, then the intervention starts. And after about 8 months later, we do the endline survey. So at endline stage, we were able to we tried to track all of these 9,000 students, but we were able to reach only 84% of them. So we have about 15% attrition rate. But when we test whether it's balanced, like it seems well balanced by treatment status. So we don't think differential attrition is a threat to the results that I will show you later, but we do some robustness tests for that in the paper too, if you are interested. But just to bear in mind, so the interviews are about 8 months after the end of the intervention. So there's a considerable gap in between them. We also, at that 8-month point, so at endline, interviewed the gender focal points and asked them about what type of actions they took after the training. We also asked them some questions, again, to check what they remember about the training. Like, for instance, can they tell us the correct number of the helpline that they should advise any victims to call? And we also did a more brief survey with the teachers, mainly to understand if there's any impact on their knowledge about laws and penalties related to gender-based violence, so that we can understand if there's a deterrence effect. And finally, we also obtained records from the helpline. Now, the helpline records, of course, we don't know exactly which individual calls and where they are, which school they're from. That's too private information. All we know from the helpline is the district that the calls are coming from and how many calls come on each day. So using this information, So this is not really like an RCT methodology, but more like a quasi-experiment or natural experiment. So we conduct we compare the provinces where we implemented the project to the neighboring provinces and see if after the start of the project, if there was a differential change in the number of calls being made. So it's like a difference in difference design. Okay, so the results I will show you, we will just mainly compare the levels of the outcomes across the different types of schools, controlling for the baseline level of the indicator as well as the randomization strata, and the standard errors will always be clustered by schools, which is our unit of randomization. So let me first show you the impact we find in terms of gender-based violence as reported by the students. So in this table, what you see is, firstly, there are two types of violence we look at: violence perpetrated by other students towards girls, and violence perpetrated by school staff, teachers or other staff towards girls. And for both types, we have two types of measures. The first one, columns 1 and 3, is an indicator for whether the student, in this case girls, reported having experienced any violence perpetrated by other students or by staff during the last month preceding the end-line survey. And the even numbered columns, so columns 2 and 4, show instead, we call this like a bystander report. So we asked all students to tell us whether in their experience, had they witnessed any girl in their class experiencing any violence in the last month, again, perpetrated by other students or staff. So this is like, I mean, they capture similar things, but one is self-reported, the other is indirectly reporting, a third-party reporting of again, the same thing, violence towards girls. So you will see when we look at violence perpetrated by other students in the control group, 18% of girls told us that they experienced any violence. This could be physical, sexual, or emotional violence from other students in their class. And relative to that, we do not find any significant difference across the treatment arms relative to the control group. That's why I was saying before that, unfortunately, the intervention did not really reduce the prevalence of violence girls experienced from other students. So peer-to-peer violence, it did not impact. And we find very similar result also when we look at violence as reported by others, but again, experienced by girls, reported by others. When we look instead, violence perpetrated by teachers or school staff, I should say, towards girls, there the prevalence is lower. So you can see in the control group, only about 1% or 2%, if we look at the third-party reporting, of girls experienced any violence perpetrated by school staff in the last month. So this is a monthly rate, right? So even though it's only 2%, if the risk of violence per month is 2%, you can imagine within the year, it's much higher. And relative to that, we do see that then, especially in the first treatment group where girls were part of the training, that's reduced by almost 1 percentage point. So it's a 67 or 70% reduction relative to that. And when we look at the other arms, T2 and T3, we again see reductions, and the findings are somewhat noisier, but the magnitudes of the estimates are similar. So that's why we cannot really say that the effects were differential for this outcome, for gender-based violence, across the different arms. So overall, it seems like, based on these results, the intervention was not effective in reducing peer-to-peer violence, but it was impactful in reducing violence perpetrated by teachers towards girls.
One
Yeah.
question. Maybe you will explain this later, but what are some of the hypotheses for not having an effect in the students?
Yeah, I'm coming to that in a few slides, but mainly what we believe is the main reason is that the intervention was unfortunately not effective in changing the students' attitudes towards violence. Maybe it was too light touch, as I said, it was only 4 sessions, and changing these types of norms or attitudes, I think, it requires a more intensive training. But I cannot say that for sure, but that's what I personally believe could be the reason.
There's a question online from someone asking if you looked at violence by staff against boys.
So we have data on that, but today, yeah, I mean, I won't show you that. I mean, as I said, the main target of the project was gender-based violence. So we're mainly focusing on the girls, but we have some data on the boys as well. And yeah, but that's, okay. We might have some results on that coming up soon. I'll definitely keep you posted. Okay, now, of course, all those results are self-reported, even though we also have these bystander reports, which is already one piece of evidence that suggests it's not just about reporting bias, but we still worry that maybe there is some experimental demand effect. Like, one reassuring thing is that, as I said, unfortunately, we don't find an effect on peer-to-peer violence, but at the same time, that's reassuring and tells us that the effects that we do find on violence perpetrated by teachers is probably not just a reporting issue, because if it was about reporting, we would expect to see effects on all types of violence, because the intervention was about any violence, not just teacher-related violence. We also conducted a robustness check where at baseline we measured, there's this standard tool about measuring respondents' desirability bias. And we use that to understand whether the effects are driven by respondents with higher desirability bias at baseline. We do not find that, so that's also reassuring. And finally, we also ask them retrospectively to report any violence they experienced before the start of the project, so before 21. And we don't see any differential rates there, again, because we would expect if it's just about reporting change, they should also report retrospectively different. We don't see that. So overall, that's telling us that the effects I showed you, it's not just coming from a change in reporting, but of course, it's very hard to rule that out completely. Okay, so then in the rest of this presentation, I will mainly talk about trying to understand where this effect comes from in terms of teachers, the violence perpetrated by school staff, and also the lack of effect, as we were saying, on violence perpetrated by other students. So the main mechanisms we thought at the start of our project are, well, the intervention should have hopefully affected students' ability to identify gender-based violence through the training, and also ideally should have changed their attitudes towards gender-based violence. And then also, of course, changed gender focal points, engagement and proactivity. And finally, made students more proactive to report, to come forward and report any violence they experience or witness. So when we look at the first mechanism, so we asked students in our survey in different ways to identify whether certain situations are gender-based violence or not. And there we do see some impacts. So let me show you quickly. So we have different vignettes and we have different items, and we ask students to tell us whether a certain situation described to them in a vignette or a certain type of action we described in this item list, do they believe it's gender-based violence? And based on that, we find, especially in schools where girls separately were trained, they're better able to identify these situations as being examples of gender-based violence. Having said that, you see that when the training happened, girls and boys mixed together in the T3 arm, there is no impact on this identification. And so this is why I was hinting at earlier before, we think one reason why that didn't work as well was because potentially it was a mixed gender group. And qualitatively, we heard back from many GFPs that it was difficult to discuss this sensitive topic when it was mixed genders. Like sometimes there would be, distractions or giggling, so probably I think going forward, it would be better if the project is hopefully scale up to do it separately if it's targeting both. We also assess students' attitudes towards gender-based violence, and there, again, we have different measures, and unfortunately, we don't find any impact on students' attitudes. So, for instance, you see in the control group, more than 50% of students told us they think violence is acceptable, and there is no impact on that. And that's why I was saying earlier, maybe the intervention should be more rigorous to change these types of embedded attitudes and norms. Now, when we look at gender focal points, so here we're mainly relying on data we collected from them at Endline. So we asked them, for instance, have you talked to the students in your school about gender-based violence? you see that in the control group, only 20% of the gender focal points, even though that is their job, only 20% said that they talked to students about this. And relative to that, the gender focal points who received our training, they are much more likely to say they did talk to students. And this is similar in all treated schools. Well, we also asked them, do you know the number of the helpline, or do you know how to recommend, what to recommend the students to do, which is to call the helpline? They are, again, much more likely to say, yes, I know. But then we had a follow-up question and we asked them, okay, then can you tell us what is the number of the helpline? So there, unfortunately, only 16% of the GFPs in the control school, they were able to tell us the correct number of the helpline. Often they were confused between the health or ambulance line and this gender-based or violence helpline. And you can see that relative to that, especially in the schools that girls were trained, the gender focal points are significantly much more likely to be able to tell us the correct number of the helpline. Still, it's not 100% of them, but it's a big improvement compared to the control group. And so this is a 24 percentage point improvement. Yes.
Great. I was just wondering if you could talk a bit more about the accountability mechanism with this staff group in Mozambique, because calling a helpline is one thing, but what happens as a result of that? Are there district officials that are involved in discipline of the teachers? Like, what's the kind of that structure? Because I'm surprised about the results with just if the mechanism is just about ringing a helpline, then that might not actually change.
Yeah, I mean, the ringing the helpline is not the only thing, but it's like part of it. So, I mean, I apologize, this is in Portuguese, but we do have the translated version in the paper that I can share with you as well. But essentially, you will see here calling the helpline, which is called Linha Fala Criança 116, is part of it. And then also reporting it to the school council, which I'll come back to in the session, is another part of it. Again, the GFPs can do it, but again, they also need the students to follow up on that. But because it's part of it, that's one of the key questions, key elements that they should call and report it, because only then the formal case can start and then triggered, and the follow-up things can happen.
Okay. It's just that in so many countries, even the formal process, like even if you do report, nothing happens.
Of course, right. So, that's another issue. I
imagine in Mozambique, do you have any evidence qualitative that anything actually happened as a result of the reporting? It's amazing that to get these results of reducing teacher behavior, even if nothing happened, actually, just the fact that they're just by reporting, if that changed behaviors, that's like amazing. But
so I don't have really hard numbers in terms of this, but we did ask them, like, have any teachers been fired, for example? And my understanding was not really. But still, I think, as you said, the levels have changed. So I feel like there's also social sanctions, of course, right? Like the fact that the issue became more prevalent and certain things are happening, I think might have also been an important part of deterring the teachers and involving the community. So that's why it would have been great to have data from the parents as well, like their awareness and their role. So I feel like we still are scratching only like a very small part of the puzzle. Yeah, but you're absolutely right. Unfortunately, the formal actions take a long time if they happen. Yeah. So it's similar in this context.
Question, sorry.
Of course.
So when you say teacher perpetrated violence against girls, like, do you have a sense of, was it more physical, sexual, emotional? Because that will really help contextualize the findings.
That's right. So in the results I showed you, it was all, but we do also then break it up. And it's mostly for girls sexual, unfortunately. And earlier there was a question about boys. So boys, of course, also might experience violence from teachers, but that tends to be more physical and not as sexual as girls.
Okay, that's helpful. Thanks.
Yeah. Okay, going back to the table I was showing before. So the second column here shows us then we also asked the gender focal points, have any students, and in particular girls, come up to you and reported to you any experiences of violence? And you see in the control group, only about 2.4% of the gender focal points said that they some students did report to them such cases. And relative to that, in schools where girls were trained, that increases by 10 percentage points, which is a huge relative increase. So that's why we believe an important mechanism was girls becoming more proactive to going up to the gender focal points and reporting in these schools. And that only happens in schools where the girls were trained separately from boys, in T1 schools. And we think that these two go hand in hand. So the fact that more students come up to the gender focal point and reports it probably helps, also means the gender focal point more frequently have to provide them the advice and the number of the helpline. And that's probably why they are more likely to know and remember the correct number of the helpline themselves. Yep.
The students reporting, is that cases of both peer-to-peer and teacher-perpetrated violence?
So in this case, we didn't ask them like whether this was by teachers. So this could be any of them. Yes. So this increase by 10% could be all of it.
And even in the case of peer-to-peer violence, is the calling the helpline the first step in the protocol, or one of the main steps in the protocol?
Yes. Yeah. It's. But having said that, I think legally, like depending on the type again, like unless it's very severe forms of violence, there's not much action that can be taken when it's peer-to-peers.
And does the peer-to-peer include dating violence, and were these children dating? Because they're a bit younger also.
There wasn't actually, I mean, initially we thought there might be, or it might be starting, but in the end it was very few, at least the reported rates to us are very low.
What was the age, exactly the age group?
So on average, it's around 13, 14, but there is some variation there. So the age and the grade doesn't always correlate, often due to repeating. So there were older ones too, but on average, 13, 14 was the majority.
Thank you.
And then finally, the gender focal points in the T1 schools they told us they were more likely to engage with teachers and again, report to the school council as well, these types of issues. So overall, so far, like those findings suggest on the student side, the intervention worked partly through helping students better identify gender-based violence cases, especially in schools where girls were trained, and also made gender focal points more active, more proactive. So we think, therefore, a key mechanism was the training provided to the gender focal points and improving that institutional capacity. Having said that, girls in T1 schools became more proactive too in reporting to them, and that will be important when we look at the downstream outcomes that are coming forward. We also, I mentioned briefly before, did a brief survey with the teachers to ask about their awareness about gender-based violence laws. And we do also find that they are more aware that there are laws in place. They tell us they are more likely to be aware in the schools where the girls were trained. And they also associate harder punishment with the engaging in such behaviors. We don't find any other similar effects on other types of legislation, which is reassuring again. So it's like a placebo test, so that we don't think it's just a general knowledge effect, but it's really specific to gender-based violence knowledge that, as it should be, given our intervention. Yes.
But we don't expect any causal link between the school is where the girls are trained and the teachers not, right? Because like say in the schools where the girls are trained, teachers are more likely to be
Exactly.
but we don't expect any causal link.
Well, we do.
Girls are trained or the boys are trained on any impact. The teachers know.
Right. So formally, like the gender focal points, like they are meant to go back and do the student training, but it is part of their job to also spread awareness, make teachers more aware that this is wrong and there are legal consequences of engaging in gender-based violence towards students. So we do interpret this as a causal effect of at least the gender focal points training. It could also be like a spillover effect, right? Like as students are being trained, teachers may ask like, what is this about, and learn from the gender focal point again, or from the students about the content of the training.
Did you have any information on teacher attitudes? And was there more than one gender focal point per school?
No, there's always one gender focal point formally gender. Of course, there can be other teachers who help out informally, but formally it's one person's position. We did not, so we had some limited time and budget, but so we did not collect detailed information on teachers' attitudes, but that would be very interesting. Yeah. Okay, so I think I'm running somewhat short on time, but I'm almost nearing the end. So I mentioned before that we also look at the national helpline numbers, but here, this is a different type of methodology because we are not comparing at the school level, since the helpline records are coming at the district level, but instead we are comparing number of calls being made to the helpline in districts. If you remember the map I showed you before, in those 7 districts where our project took place, relative to the neighboring districts, and how the level of these calls change once our project started. And you can see here the red line, the dashed line, is indicating the start of the project, and each point on the x-axis is like it's the 2-monthly period. And in the period before the project started, there was no significant difference between number of calls being made in our study districts relative to the neighboring districts. But shortly after the project starts, like about 3 or 4 months later, we start seeing a significant increase in number of calls that the helpline was receiving. And so that's, again, indicative of more reporting of violence in general. So in these calls, we are not differentiating gender-based violence from other types of violence, but it's just violence overall. But again, it suggests that something was happening related to our project. Now, the fact that there are calls being made doesn't always mean that these calls end up becoming formal cases. But we also have information about number of cases that were made based on these calls converted to formal cases. And we also see some increases there, although here the results, as you see here, are much noisier. But there's a similar trend in the longer term, especially a rise in the number of formal cases being started. So according to these reports, 80% of the calls typically become cases. But in order for this formal investigation to happen involving the victims as well as the school and community is important. Social workers need to engage with schools, with family, victims, and relevant legal authorities in order to provide the right support and encourage the victims to report. And also the potential perpetrators are more likely to become aware of these issues and prevailing formal and social sanctions, therefore related to gender-based violence. So that's why we feel like ultimately, in order for all of these channels to be activated, we need like different players, like both the gender focal points in our case and the girls, to be more proactive. And this is the final result I will show you. And here you see the school enrollment rates based on school administrative records of girls in our sample at end line. So this was 8 to 12 months after the end of the intervention. You will remember that our sample by design consisted 100% of students at the start of our study, but about a year later, only 61% of them in the control group are still in school. And that's because, as I mentioned, many of them graduate from upper primary school and they do not necessarily transition into secondary level. So the 40% of them are lost. But relative to that, you will see in the schools where girls were trained, T1 schools, the enrollment rate is significantly higher. It's 66%. So that 6% increase is like a 10% effect relative to the control group. And we only see that being significant in T1 schools. Having said that, in T2 schools, there is also a positive effect of 2 percentage points, but this is not significantly different from 0 statistically. It's very noisy. And in T3 schools, where girls and boys were together trained, there is, again, similar effect, about 5 percentage points, and it's not really significantly different from T1. So we interpret this as evidence that it's important, therefore, to involve the girls. In particular, girls must be trained and aware of what to do and how become more proactive in reporting in order for the effects on gender-based violence to translate into effects on their schooling. Yeah.
Just to follow up. Sorry. Yeah, follow up on that. for the enrollment side. So you were asking the girls that had had the intervention a year later, are you still in school? Of which some might have actually changed school to go to secondary
Yes.
school. So it would have been they would be going to a different school to the one the original intervention is.
That's right. Actually, here we are not using the data from the student survey. This is data from the school's administrative records, and the schools here could be the upper primary schools and secondary schools. So we obtain the records from all the schools in the Sofala province, and then we check whether the girls in our sample are enrolled in any of them, whether secondary or upper primary. As you said, many of them will be at secondary at this point, but some of them could still be in the primary school, because if you remember, part of our sample are sixth graders. So they would be in seventh grade, for example, or they could be repeating grades, of course.
Okay,
So we combine all of them.
So so then the like mechanism there is just the fact that girls are more aware of what is a GBV incident. That's because they might have a different teacher, or that they might go to a different school that doesn't have a trained gender focal point. Yet the fact they still are enrolled, that's what is I'm a bit.
I see. So they are for the ones who transition to secondary school. So we interpret this as an effect that when they were already in the upper primary school where they were at the start, like the mechanisms could be they're more aware. They're also they have a more active gender focal point who provides better support for them, who reports cases, right? So overall, and in their school, there's a reduction in the violence perpetrated by teachers, right? So that might affect both for them, their feeling of safety, and also for their parents, right? Like it would be great again to have data on that, how the community perceives safety of girls in schools, and that might help them transition to secondary school.
Okay.
Yeah.
Can I ask a follow-up?
Yes, of course.
For the schools that did offer primary and secondary education, do you see if there is a higher likelihood of these girls of like staying in the same school other than like switching to another school just because maybe they received the intervention and they feel safer in that school? Not sure.
That's a great question. And I think, we can check that. We haven't, but we can definitely do that because as you said, some of these upper primary schools share the campus with the secondary school. So we haven't checked that, but that's a great point. Thank you.
Thank
you. We're just about at time, so I just want to, if anyone needs to leave, then feel free. But we have the room, so I think we can carry on for a few minutes.
Perfect. I'm done in any case, so I'll just leave the conclusion slide here, but I've said everything on the slide already. Thank you so much.
Thank you.
Thanks so much, Salim. This is fantastic. I think it's very easy for people to be jaded about workshops and trainings and seminars, but this is essentially just a few days of trainings, which seems to have prevented many, many cases of sexual violence and increased school enrollment, which is just amazing to see. But thank you.
Thank you. Thanks for having me, and thank you for all the questions. Thank you so much. Of course, yes. Yeah.
So I was interested in why you did this in Mozambique. I was interested in who funded it. I'm interested in the role of the NGO, like sort of how this came about, basically. Why there? Where did the money come from? And where did the intervention come from? Like who invented that? And what was the role of the NGO? And what are they going to do with this now?
So the reason it was Mozambique was, partly, we were there and we were doing some other projects also related to this topic in universities. And then we had some meetings with the ministry. And I think the main reason we were able to do this project was they were already aware of the issue. So there had been recent reports by UNICEF, for example, that some of the numbers I mentioned in the first slide, specific to Mozambique, were coming from that. So both UNICEF partners and the ministry were aware of the issue. And as I mentioned before, they had identified gender focal points, for example. So they were doing things. And then we had this meeting with them and we understood that there is this momentum, but some challenges, like the training needs to be done. So we sat down and did, together with them, decided on the intervention. And the funding you asked, well, like you see all the different funders here, UNICEF, GIZ, Leibniz Association. Now, the role of the NGO Girls' Child's Rights was mainly to make sure that the training at schools, which was some of them were hard to access, was being done as intended, and if there were any technical issues or any challenges that the GFPs might face, for example, like they are there to help out. Yeah, but going forward, like if hopefully if this intervention is adapted or scaled up, we are actually discussing this with UNICEF, for instance, in Mozambique, like how would we adapt? Do we need an NGO? It's not clear. I mean, in this case, we of course felt like it was necessary, but going forward, I think these types of scale up questions are very important. We have yet to figure them out.
Sorry, there's a couple of questions online about whether you're able to share any of the survey tools and any of the training materials. That's one
Sure.
route to
Yes.
scale
Yeah,
up.
if you reach out to me via email, like we'd be happy, we can touch base about that. Absolutely. Thanks.
Yeah, just another follow-up question from Caroline on the cost. Because yeah, I take it from Lee's point, and it sounds relatively low cost having to do a training. And I guess the potential for this is that if you have school staff who are supposed to be doing this and it's just about kind of upskilling them, then that's fantastic. But yeah, do you have more data on the cost and like did they receive, was there other support throughout the year? And I guess also the hotline, just because when I've seen those hotlines in other countries as well, there is some sort of cost to having a hotline, which people can use to report any violence linked to any. And I wasn't sure in this case if it's just any like aid program. It sounded like maybe it was like that, but then again the mechanism behind what happens and how the government gets involved, and you mentioned before that like the social workers getting involved. Because so often they need travel budgets, and that's where it starts to get really sticky to do that. So I wondered, do you have any more info on cost, just to thinking about that scaling?
I know about the costs related to our intervention, but I don't know enough about the cost of the helpline or cost of identifying the GFPs in the first place. Of course, all of these costs, but I mean, I can definitely ask and find out more, but right now I don't know.
No,
sorry.
of course. Yeah, no, it's just really interesting thinking about that scaling.
Yeah, definitely.
Journey.
But as I said, like at least UNICEF Mozambique was very invested in this topic, and they're doing a bunch of other things too. And that's why I think, we were lucky enough to meet them and then get support from them as well.
Yeah, I have two questions. One is broadly around dating violence. Did you think this was the right time or right moment to include dating violence given the effects like in the program? And I'm curious also, usually at least like in places, sometimes there's a lot of resistance to including anything around dating in primary schools, even like lower secondary schools, even secondary schools. So how did you navigate that? Like, why was that chosen to be something that what was the context around introducing that program? And then do you think there might also be impacts that might come in later when these students start dating at a maybe slightly older age? So that's one question. And then the second one is just around the timing around COVID. And I know a lot of school closures happened at that time. So I'm just curious how that may have impacted your baseline and just generally the initial fits. Yeah.
Yeah, so the COVID definitely impacted a lot and increased the cost. Like we were just about to start and then we stopped, waited. Yeah. So it all started, if you remember the timeline, shortly after the end of the school closures in Mozambique, so 21. So yeah, there were lots of course, measures we took to avoid it. So yeah, there was these types of implications, absolutely. In terms of dating violence, so we decided to include it because that was part of, again, the curriculum the ministry had already designed and intended. And based on that, we thought, it would be an important issue to have. However, yeah, as I mentioned before, there wasn't a lot of dating, at least reported to us by the students yet. But as you said, maybe going forward, there might be effects longer run. I mean, right now we don't have plans to do follow-up studies, but it would be, I think, very useful if we could see if there were long-term effects on that dimension.
Thank you.
Oh, sorry.
Well, I was just wondering about what was back in the decision of choosing 6th and 7th graders, I think it was.
Yes.
especially because some of them are going to secondary education, some are not. And probably, I don't know if the impact on enrollment is different for those in sixth grade than those in seventh grade. Yeah.
Yeah, so initially we wanted to target only the last grade, seventh grade of primary school, because as I mentioned before, like there's a big dropout rate happening on that transition to secondary level. So we wanted to try to impact that retention rate. And the ministry, actually, they guided us towards the seventh grade. But in some schools, like seventh grade was either too small, or we felt like it's important, it could be useful to also include even a slightly younger age. So sixth and seventh, like we decided to go for them together. I don't remember now if we checked whether the effects were different for both, but you're right, like some of the sixth graders are still in the primary school at the end of our study. Yes.
Can I just make a comment? So a while ago, I led the production of a evidence and gap map looking at child, what was it called? It was about child protection, like responses to how organizations respond to child maltreatment. So how organizations prevent it within their organization, so schools, swimming clubs, churches, whatever, and also what they do to try to prevent it happening elsewhere. So like educating the child about how not to be abused by your uncle or whatever. And we did this globally, and we did it twice actually. And the interventions that were overwhelmingly the most well-researched were programs in schools with children, teaching children what abuse is and how to avoid it and what to do if it happens to you, like how to report it, and like good touches versus bad touches, basically. And it seems one of the things that we were very struck by was that this is educating, this is an intervention with the victim, right? It's not. And I went to the Sexual Violence Research Initiative conference, where people talked about loads of research on sexual violence, loads of different types of research, many different countries. And most of it was research and programs to with women and girls who are not the problem, right? Like most of the research was on interventions with and for people who are not the problem, right? And it's just interesting thinking about that in the context of what you found, because what I take from this is that where you did the intervention just with the girls, you found some effect. Right. And where you did it just with the boys, you found basically no effect. And where you did it with a mixed group, sometimes you found a bit of an effect, but it was much weaker than just the girls. And it's just kind of interesting. I'm just kind of reflecting on that maybe, it's not so bonkers to work, have programs that engage the victims and potential victims rather than with the people who are frankly the problem. Your research findings seem to kind of support that.
I think it's important. I mean, our findings suggest that definitely it's important to engage with the victims, because at the end of the day, we need to rely on their reporting and being more proactive. But bear in mind that we also always, in all the treated schools, there was this gender focal point activation, right, the training. And then they also created awareness amongst the teachers. So there was some, in a way, indirect treatment to the potential perpetrators in this case, when it comes to teacher-perpetrated violence. Right. And the reason we targeted boys, we thought it could be because they could be potential perpetrators too, but in the end, it didn't impact on them as much. But teachers, therefore, indirectly, through the gender focal point, who's a teacher themselves, were targeted. So our results, we interpret them as being indicative that it's important both levels. You had a question.
I just wanted to go to online. Sorry, Ruti Levtov, did you want to ask a question?
Yeah, thank you so much. And hi, Salim, thank you for the presentation. And this actually relates a little bit to the comment that we just heard. I was trying to reflect on the sort of not finding results on peer violence. And I was curious about whether the content of the intervention with the kids was really focused on violence against girls, or whether as part of that there was some recognition that violence was also happening kind of in the school context to others. And I'm thinking about this in the context of potential sort of not necessarily backlash in the sense of increased violence, but backlash in the sense of the boys not engaging as much when in their experience, school staff is also hitting them. And we often see higher rates of physical violence for boys, not sexual, like you said. And whether there's something about that dynamic. And I also wonder if that similarly, and you had mentioned that the conversations were maybe less kind of more stilted or whatever in the groups where boys and girls were talking together. So I think, for all of these, we have to pay a lot of attention to what happens in the intervention itself and the dynamics there. But yeah, I was curious if you had any reflections on that.
Yeah, no, thank you. These are all great, excellent points. And you're right. So the intervention was more focused on violence towards girls, and that could very well be one of the reasons why maybe boys were therefore less impacted and less involved. And as I already mentioned, it was also quite light touch and limited time, partly because, we were concerned about if it was more intensive, what would that imply about in terms of crowding out in-class learning. There were some challenges about asking students to stay late in after school hours. So, all these considerations, but absolutely, I mean, I think I totally agree with you that it would be great to be able to understand better, and in understanding the content of the intervention and thinking about it carefully is definitely the way forward to better impact the students and boys in particular.
Thanks. And if I could just kind of add quickly in response to the person who was mentioning earlier, interventions working with sort of the victim. Obviously, those are also very important and clearly play a role. But I think if you look at the evidence more broadly on violence against women, a lot of what does work is programs that work with both, like programs that work with couples and parenting programs, things like that, where you are working with the perpetrator, but perhaps with a sort of a deeper, deeper set of tools and things that you do. Thanks.
Thank you.
Hi. Yeah, I just had a quick question on it increases school enrollment, but doesn't increase or have an effect on test scores. Is there a reason why that is the case?
That's a great question. Yeah, so here I skipped through it, but yeah, we do not find any improvements in their math or Portuguese tests these are based on standardized tests that we did ourselves. Now, why that was, I mean, it could be that maybe our test didn't measure properly what they're actually learning in school. So here we use these EGRA tools. I don't know if you're familiar. Maybe they don't always measure necessarily what the curriculum covers, or it could be related to, I don't know, the quality of the education. I'm not sure, but not necessarily being more likely to be in school did not translate into being better at these. But we don't know exactly why.
Can I share something?
Yes,
we
of
also
course.
observe the same in a study we have in Peru. So in Peru, we also see that there is a improvement more in enrollment or likelihood of being at school, but we don't see effects in learning in the short term. So I think there is a question on whether these type of interventions might affect learning later through changing the school environment, and that might take longer, but we don't have many studies looking at the medium term, so that might be a limitation perhaps.
Yeah.
Thank you. I have a question related to the gender focal point. So I was wondering if you found any effects by the characteristics of the GFPs, and do you know in general, are GFPs a desirable role to have, or is it sort of an extra burden to teachers? Does it come with extra pay?
So we don't have a lot of variation in terms of characteristics. Like in terms of gender, like 90% or so of them are female. So there's not a lot of variation on that side. And yeah, so to be honest, like we didn't really exploit a lot of the differences, mainly because of power issues, right? Like we only have 300 of them, so it's not, it's difficult. And we were not sure. But if you have any specific like hypotheses or certain dimensions that you think we could check, like feel free to let me know. And whether they are paid, as far as I remember, if I remember correctly, they are not paid extra. So yeah, I mean that would also be good to understand their like how those incentives, financial incentives, might make them even more effective potentially.
I'm just curious if the GFP training included any aspects of engaging with other teachers as well in the school, or was it mostly targeted on how to encourage students or to identify violence and encourage students for the reporting mechanisms? Well, I think that relates a bit to Leaning's teacher attitudes a bit more generally as well. Yeah, and I guess you didn't collect teacher surveys amongst all the teachers within the schools. So yeah, that might be interesting.
Yeah, absolutely. So the GFP training that we provided them, like it was targeted towards improving their capacity to perform their job, and part of that job is to create awareness amongst the rest of the teacher body about the issue. So in that sense, it was covered in that training. Having said that, it's not like we organize them, like with the students. We did not organize a training for the teachers by the GFPs, but they should have done that, and that's why we were looking at those effects I mentioned in response to your question. But yeah, I would have loved to be able to collect more data on all the teachers about their attitudes and so on, but we were not able to do it.
Okay, I think if that's all the questions, then we should draw it to a close. Thank you so much again, Salim, and thank you all for coming. This was really excellent.
Thank you so much. Thank you.